We're a county of about 150,000 people. We're one of the most diverse counties and cities in the state of Kansas. Nearly half of our population is minority. We have nearly 1 in 4 children in the county are in poverty. So we're diverse both socially and economically. We're a proud community. We're the smallest county physically in the state of Kansas and thus one of the most densely populated. So I took those rankings and said, this is a charge. This is going to be part of what our mission is. I'm making as an action call to our citizens the idea that we need to create a healthier community going forward than we have today. That wasn't part of my agenda in that way prior to the county health rankings.
For this group. Thank you all for being here. The County Health Rankings Report has become a catalyst for our community to come together to seriously discuss these issues and come up with community-wide strategy.
Last meeting that we had, the steering committee basically endorsed the Complete Streets Initiative to be considered by the unified government.
On Wyandotte today, we've asked people from all sorts of sectors, from social services, education, housing, higher education, faith-based organizations. When we all work together, we can accomplish so much more than we would singularly.
Part of this policy change in Complete Streets is to think about how what we do affects health. How do you consider resurfacing the street affecting health?
So they're long-term measures of health, and I think, Mayor, you were talking about you're going to need some short-term measures, which is...
¿Por qué? Porque a veces...
Part of the reason why we're so diligent about searching out evidence-based programs and policies is simply because in Wyandotte, we're working with finite resources. So we want to make sure that we not only maximize impact with our policies and programs, but we also maximize efficiency so that everyone's working together towards programs we know can be successful.
Hola, Mónica, ¿cómo estás? ¿Cómo estás? Bien, gracias. Un poquito de frío, ¿verdad?
The Promotoris program is something that only, I think, an agency like El Centro could do successfully.
Hola, ¿cómo estás? Buenos días. Buenos días.
El Centro is a community-based organization empowering families through a diverse program of health intervention and health education. Promotoras are individuals from the community that El Centro trains, and we help them understand their own strengths. We help them understand health issues, and smoking is one of the primary issues.
¿Y qué tanto saben ustedes?
So how much does everyone know about tobacco? Who knows how it damages your body?
These people are mostly new immigrants. They live in poor neighborhoods, so promotors are really trusted individuals who can share information with them.
Ahorita que ustedes están...
Now that all of you are getting this information, you can pass it along to your neighbors or other folks. Between all of us, we can spread the word, and that helps.
So I'm very fortunate that we have a solid foundation as a social service agency that's so good at what they do and is taking this next step to talk about prevention.
Muchas gracias a todos.
Previously, this market was underserved. We were the first store built in the last 35 to 40 years. So being able to get the tax credits, we were able to better serve the needs of our community.
We took that public-private partnership model that we knew pretty well here, and we really, I think, we have made lasting social change that's going to help the health of our community, our citizens, in the daily lives that they have and the choices that they make.
Everything is nice and fresh, and it's close to our home. Instead of going to small corner shops, we can come here and get much better prices. Here in our neighborhood, we can go ahead and get fresh vegetables and fruits. It's a lot healthier. It's much better for our family.
When we focus on early childhood learning, We're setting up our young people to be more successful and be healthier in their lives.
Chugga, chugga, choo, choo.
Educare is an exciting initiative in the United States. We use evidence-based practice. We're building their cognitive development. We're building early language and literacy skills.
Classroom teachers did the ECI, the Early Childhood Indicator. We look at gestures, we look at vocalizations, we also look at single words and multiple words. We tested her first when she was 9 months old, and then we went to 12 months. So you can see there's an increase here.
And above all, we incorporate the parents, and they become an extension of our plan with the children.
Kids do not come with instruction books. I cannot raise a child by myself. Being a single mom is so hard, but every time I come here, it's been really, really helpful for me and her. Every day I learn something new.
We know that if kids enter school with these developments on target, that they're going to succeed in school and life.
You say thank you to Ted. Thank you.
Look, this thing that you, at first blush, might not look like it's about a healthy community, it's all about a healthy community.
The county health rankings were a really important tool in getting the Wyandotte Healthy Communities Initiative started. They're not only an indicator for where you're at in terms of health, but they're also a tool to understand where you could be.
The county health rankings were a call to me to say, you're not going to be the best community you can be if you don't focus on the health of your community. Not just access to health care, but the health of your community in every aspect of social and economic aspects of Kansas City, Kansas, and Wyandotte County. That was a thought process and an approach that I had not taken, and I don't think I would have without the county health rankings.